Hi, my name's Katie. I'm one of the dietitians here at Sherwood Forest Hospitals. The role of a dietitian is to diagnose and support people with nutritional problems related to their disease. The management of disease is where we differ to, say, a nutritionist or a nutritional therapist, for example. And a dietitian is a protected title, so if you're seeing a dietitian, you can be assured that they are qualified and registered in order to give you advice. Throughout your cancer journey, one of the main things we're trying to do is make sure your body has the nutrition to help get you through any treatments you're having, but also to fuel your immune system, make sure your body still has the strength that it needs to do all your everyday tasks like shopping and cooking and washing and things, and just make sure that you can continue to function and do everything that you need to be doing. There's a lot of false information out there, especially relating to nutrition and cancer. You'll see lots of different things on Google, so the turmeric diet and the alkaline diet are very popular ones at the minute, and it's really difficult for people to understand what information is true and what is accurate. And those two, for example, have no evidence base. There's nothing to suggest that they are going to help you. What I'd suggest is if you've seen anything that you think you want to try, Cancer Research UK has a page on their website on alternative diets. And I'd go there first. They'll help you determine whether or not that information that you've read is true or not, just to make sure that you're not doing anything that might be detrimental. The nutritional aim is to try and maintain your weight as best we can while you're going through any treatments in your cancer journey. There's lots of different things we can do to achieve that, and it can be really difficult at times, especially if you're getting a lot of symptoms or side effects. One of the main things is to try and keep your weight as stable as it can be and prevent any rapid or unintentional weight loss. Even if you're slightly overweight, it's not the right time to be trying to lose weight because your body needs all the fuel that you can get at the minute. People will often struggle with a poor appetite, particularly while they're going through their cancer journey. One of the main things is to try and reduce your meals portions. So perhaps have small or half portions at meals if you're really struggling with appetite, but then add in some snacks in between just to try and keep the calories and the energy up. You can also add high-calorie options to your food, so add in a little bit of extra butter or extra cheese, just to try and keep the energy up if you're only managing small portions. It's completely normal, and it's just adjusting your diet and how you eat to try and keep your energy intake up. We also relax some of the rules on healthy eating, for example. So we'd suggest having high-calorie snacks, things like cakes and biscuits and chocolate that you've probably avoided previously in your life. Because at the minute, what is healthy for you is slightly different, and it's all about trying to keep those energy levels up and keep the nutrition going into your body. This can be really difficult at times if you're getting a lot of side effects and symptoms, okay? So if you're really struggling, Macmillan have a leaflet called the Building Up Diet, and this will give you loads of tips on high energy options and things you can add to your food to try and keep the energy up. So please use that if you're struggling. You can also get a lot of symptoms like nausea, changes in your bowel habits, pain and soreness in the mouth, or taste changes that could make eating really difficult. Again, Macmillan have a leaflet on eating problems and cancer, and that's really helpful and got some really simple techniques for you. For example, if you're struggling with taste changes, people will often report a metallic-y taste in their mouth, particularly with certain chemotherapies. So things like using plastic cutlery can really help to get rid of that metallic-y taste. Or stronger flavours, so using spices or citrus flavours to try and cut through those strange tastes in your mouth. Also trying different foods and textures, so if things are tasting odd, then different textures can help. Crunchy foods, so things like crunchy salad or crisps, can give you more enjoyment from eating if things aren't quite tasting right. Another thing is if people are struggling with nausea and sickness, this is really common again. So things like peppermint and ginger flavours can really help with nausea. So having peppermint or ginger tea or sweets before you're eating can help just reduce some of that nausea. Also trying to avoid cooking smells can really help. Smelling fatty foods frying, for example, can really make people feel quite sick. So trying to avoid that as much as possible. And if it's you that is needing to do all the cooking, then having cold foods or ready meals, or perhaps cooking in bulk when you're feeling better, and then freezing portions so you're not having to cook on days when you're not feeling well, so you're avoiding all those smells associated with food. One of the other common things people will struggle with is fatigue, so just simply not having the energy to do your food shopping and cooking. Then we'd suggest online shopping if you can, or getting someone else to do your shopping, just making sure that you've always got food available in the house so you're not having to go out on days when you're particularly fatigued. Also cooking in bulk on days when you're feeling better and freezing individual portions, so you've got easy meals, and having snacks about the house, so keeping kind of snacks, crisps, sweets, nuts, those sorts of things in your front room so you're not having to get up all the time and go to the kitchen on days when you're struggling, okay? Ready meals can also be a really good thing. Don't worry about having them and considering them unhealthy. They can be a really easy, nutritious option for you on days when you're struggling. It's better to be eating something than not eating anything at all. Sometimes people will have the opposite problem, particularly after their cancer treatment has finished. And with some of the breast and ovarian cancers, it can be a particular problem where people gain a lot of weight following their cancer. Again, it's simple things, so cutting out those high-calorie snacks that perhaps you've been having. Again, trying to keep your portion sizes of meals down, but making sure you're eating regularly throughout the day and not avoiding any food groups. So we wouldn't want you to cut out carbohydrates or anything like that, for example, because they're still a really important source of nutrition and vitamins for you. Another thing you can do to help is to try and increase your energy levels as perhaps you're getting more energy and feeling a little bit better, just so your body's burning some of those calories. And again, there's a Macmillan leaflet to try and support you with that and give you some simple ideas and things that you can do at home. What I would say is before and during any treatment that you're having, we wouldn't advise you to be trying to lose weight. It's something that we'd look at after your treatment, okay? So please don't try and lose weight unless you've been advised to do that for surgery. Now is not the right time to be doing that, but it's something that we can look at afterwards. So in terms of accessing help, there's lots of places you can go for further information. As I've said, Macmillan has a number of leaflets on nutrition and diet that can be really helpful and give you really simple ideas of things you can do at home. You can also contact your clinical nurse specialist, and we'd advise you do that early as soon as you're starting to struggle, because it's much easier to prevent problems than it is to try and manage them once they've started. If you're continuing to struggle, then your nurse specialist, your consultant or your GP can refer you on to a dietitian. So we're based here at the hospital, or there's another team in the community that can offer you support and guidance. We may look at things like nutritional supplements. So if you've done all the food first things, so added in the extra snacks and added in the extra calories to your food, but you're still struggling, we've got other options, and I've got some here, but there's lots of different types and varieties and brands and things that we can use, and we'd find the product that best matches you and your needs at the time. So to summarise, the main aim is to try and maintain your weight and maintain a good nutritional intake throughout your cancer journey, trying to keep your weight steady and make sure your body's getting all the fuel that it needs. Have snacks, easy meal options available. Don't worry about having things that perhaps you've always thought to be unhealthy, like ready meals or high-calorie snacks, okay? Your body needs that fuel at the minute, so don't worry about having things like that. Food should also be something you enjoy, so try and avoid pressure around food. It's often something that between partners or relatives and friends will say, oh, you're not eating, you need to eat more. Try and avoid all that pressure. Just do what you can. Don't put too much pressure on yourself, and just eat little and often. No one's expecting you to eat in the way you perhaps have up until now. The final thing would be to try and seek help early. It's a lot easier to try and manage problems before they've got out of control. There's a lot of support available to you, so don't struggle at home on your own. Either contact your clinical nurse specialist or your doctors, and then they can direct you to the appropriate people.